Did you know that the way you sleep tonight could be silently raising your risk of stroke, stealing oxygen from your brain, and quietly aging your body in ways you would never see coming? It sounds shocking, but according to new research from the American Heart Association, certain sleeping positions can increase stroke risk in adults over 60 by more than 65%. And here is the part that keeps me up at night as a doctor. Most seniors are sleeping in these exact positions right now without any idea of the danger they are in. For millions of older adults, sleep has become something they dread, waking up stiff, exhausted, foggy, and in pain. But what if the problem is not your age? What if it is not your mattress or your pillow? What if the real danger is the exact position your body rests in for 8 hours every single night? Scientists now confirm that your sleeping position directly affects blood flow to your brain, oxygen levels in your blood, pressure on your spine, and the strain on your heart. The wrong position does not just cause discomfort. It silently triggers the kind of damage that shows up years later as memory loss, balance failure, and in the most devastating cases, a stroke that changes everything. Tonight I am going to share with you the 4 sleeping positions that are silently raising your stroke risk after 60, and the 4 powerful alternatives that can protect your brain, restore your sleep, and help you wake up feeling safer, stronger, and more alive. Stay with me because what you are about to discover could literally save your life. Before we go any further, if you have not subscribed to Dr. Rose yet, please hit that subscribe button right now and turn on the notification bell, so you never miss another health tip made especially for you. If this video helps you tonight, type 1 in the comments. If not, type 0 so I know how to serve you better. Now let us begin. Part 1. The 4 sleeping positions silently raising your stroke risk after 60. Position 1. Sleeping flat on your stomach with your head turned to the side. It might feel natural at first. Lying face down, cheek pressed into the pillow, body sinking into the mattress as if the weight of the day is finally lifting. Many seniors, like Mr. James, a 74-year-old retired postman from Kentucky, say it is the only position that ever felt truly comfortable. My whole body just settles, he once told me during a routine checkup. But what James did not know was that every single night in that position, he was quietly choking the blood supply to his own brain. When you sleep face down with your head turned to one side, your cervical spine, those 7 delicate vertebrae in your neck, is forced into an extreme and unnatural rotation for hours at a time. According to the American Stroke Association, sustained rotation of the cervical spine during sleep can compress the vertebral arteries, the 2 critical blood vessels that run alongside your spine and feed directly into the base of your brain. When those arteries are compressed night after night, blood flow to the brainstem and cerebellum is reduced, silently increasing the risk of vertebrobasilar stroke, one of the most dangerous and often undetected types of stroke in seniors. And the danger does not stop at your neck. Pressing your chest into the mattress prevents your lungs from expanding fully, reducing your oxygen intake by up to 30% according to respiratory sleep studies. For someone over 60 whose lung capacity is already naturally declining, this means your brain is being quietly starved of oxygen for hours every night. Less oxygen to the brain means more strain on the heart, higher blood pressure, deeper fatigue, and a brain that wakes up slower, foggier, and more vulnerable every single morning. Dr. Patricia Simmons, a vascular neurologist with over 25 years of experience, describes stomach sleeping as the position most likely to go undetected while causing serious cerebrovascular damage in older adults. She tells her patients it is like slowly bending a garden hose every night. Eventually the flow stops without any warning. So while stomach sleeping feels comfortable, it is quietly putting your brain at risk one restless night at a time. But if sleeping on your stomach is this dangerous, what about that curled up position so many seniors find irresistible? It feels safe and warm, yet it carries its own shocking threat to your heart and your brain. If you are still watching and finding this valuable, please type 1 in the comments right now to let me know you are with me. Let us move to position number 2. Position 2. Sleeping on your right side in a tight curl. There is something deeply instinctive about curling up on your side at night. Knees drawn close, arms tucked in, body folded like a question mark against the dark. For Mrs. Agnes, a 71-year-old retired bookkeeper from South Carolina, this had been her sleeping position her entire adult life. I feel protected that way, she told me quietly during her first visit. Safe, like nothing can reach me. But Agnes had been waking up for months with heart palpitations, a heaviness in her chest, and an exhaustion so deep that no amount of sleep seemed to touch it. When I asked her which side she slept on and how tightly she curled, the answer told me everything. Sleeping on your right side in a tight curl is one of the most quietly dangerous positions for seniors over 60, and almost nobody is talking about it. When you curl tightly onto your right side, you place direct compressive pressure on your heart. Your heart sits slightly left of center in your chest, and when you curl right, your other organs shift in that direction, crowding the heart and forcing your cardiovascular system to work significantly harder through the night. According to a study published in the Journal of the American College of Cardiology, right-side sleeping combined with a tight curl position can reduce cardiac output and increase the frequency of atrial fibrillation episodes in adults over 65 by nearly 20%. Atrial fibrillation, an irregular heartbeat, is one of the leading direct causes of stroke in older adults. And while your heart is struggling, your brain is suffering too. The tight curl compresses your diaphragm, reducing lung expansion and dropping blood oxygen levels throughout the night. Your spine curves into an unnatural C shape that shortens the ligaments supporting your posture, worsens spinal curvature over time, and quietly increases your risk of losing balance and falling. Dr. Marcus Webb, a cardiologist specializing in senior sleep health, puts it plainly. For patients over 60, consistently sleeping in a tight right side curl is like asking your heart to run a slow race all night while everyone around it rests. Agnes made one change to her sleeping position, and within 3 weeks her palpitations had reduced dramatically. She called my office on a Tuesday morning and said, "Dr. Rose, I woke up this morning and my chest felt quiet for the first time and I cannot remember how long." That is what the right information at the right time can do. But if the right side curl is so dangerous, what about sleeping on your back the way so many people believe is the correct and healthy way? What I am about to tell you might completely change what you thought you knew. If you are still watching, please comment number 1 below. Now let us go to position number 3. Position 3, sleeping flat on your back without head and neck support. For generations this was the position doctors recommended. Flat on your back, spine straight, arms at your sides. The clean, disciplined, correct way to sleep. And for younger adults with strong muscle tone and open airways, there is some merit to that guidance. But for seniors over 60, sleeping completely flat on your back without proper support is silently one of the most dangerous decisions you make every single night. Take Mr. Calvin, a 77-year-old retired high school principal from Georgia. A measured, thoughtful man who did everything right. He ate well, walked daily, took his medications without fail. But his wife Beverly had grown increasingly frightened by what she witnessed every night beside her. Terrifying pauses in his breathing. Sudden violent gasps. Mornings where Calvin could barely remember his dreams, and woke with headaches that lingered until noon. When Calvin finally came to see me, the results of his sleep study were alarming. He was experiencing obstructive sleep apnea. So severe his airway was collapsing up to 34 times every single hour. And his flat back sleeping position was a primary contributing factor. When a senior lies completely flat without proper head and neck elevation, gravity pulls the tongue and soft palate backward, narrowing the airway and triggering repeated cycles of oxygen deprivation through the night. Each time the airway collapses, the brain sounds a silent alarm. Stress hormones surge. The heart rate spikes. Blood pressure climbs. And this dangerous cycle repeats over and over and over again while you sleep completely unaware. According to the National Stroke Foundation, seniors with untreated sleep apnea face a 70% higher risk of ischemic stroke compared to those without the condition. Every collapse of that airway is a moment where your brain is being deprived of the oxygen it needs to stay healthy, stay sharp, and stay safe. Flat back sleeping also accelerates acid reflux, a condition affecting more than half of all adults over 65. Without elevation, stomach acid travels freely up into the esophagus, silently burning the lining of your throat, and over time causing damage that can extend to your airways and lungs. For Calvin, the diagnosis was a turning point. He told me, "Dr. Rose, I thought I was taking care of myself. I never knew the danger was in how I was sleeping. Sometimes the most dangerous things in our lives are the ones we cannot feel. And if sleeping flat carries this much hidden risk, what about that beloved recliner chair that so many seniors have quietly moved into as their permanent bed?" The truth about what it is doing to your body is deeply shocking. Please comment number 1 if you are still watching. Let us go to the final dangerous position. Position 4, sleeping every night in a recliner chair. It begins so gently. The recliner is soft. It cradles your back, eases your hips, and lets you drift off without the struggle that a flat bed has become. For Mrs. Ruth, a 80-year-old retired elementary school teacher from Mississippi, the recliner became her sanctuary 2 years before she first came to see me. Lying flat had become impossible with her back pain. The recliner gave her the first restful nights she had experienced in years, and she was grateful for every one of them. But something was changing quietly beneath the surface. Her ankles had started swelling so badly, she could barely get her shoes on in the morning. Her thinking felt slower. Her energy had faded to almost nothing. She told herself it was just getting older. She was wrong. Sleeping in a recliner chair every night is one of the most silently destructive habits an older adult can develop, and most doctors never ask about it. According to Dr. Helen Carter, a geriatric medicine specialist, the semi-reclined position of a recliner chair chronically restricts venous return, meaning the blood pooling in your legs cannot travel efficiently back up to your heart. The result is progressive fluid retention, dangerous ankle swelling, and in serious cases deep vein thrombosis, blood clots that can break free, travel to the lungs or brain, and cause a pulmonary embolism or stroke without any warning at all. The recliner also keeps your spine in a permanently compressed semi-seated position that prevents the natural overnight decompression your vertebrae desperately need. Your spinal discs cannot rehydrate. Your core muscles slowly weaken from disuse. Your hip flexors shorten and tighten, pulling your posture forward and dramatically increasing your risk of a fall. But the deepest damage is one you cannot see or feel at all. Recliner sleeping permanently fragments your sleep architecture, preventing your brain from ever reaching the slow wave and REM stages where real neurological restoration happens. Your brain never fully clears the metabolic waste that accumulates during the day. Your memory never fully consolidates. Your immune system never fully rebuilds. You might spend 9 hours in that chair and wake up more cognitively depleted than when you sat down. Ruth returned to a proper bed with the right positioning modifications after I explained what was happening to her body. 6 weeks later, she came back to my office and said something I will never forget. She said, "Dr. Rose, I did not realize how far I had drifted away from myself until I started coming back. If the recliner is silently destroying senior health, where is the safest place to rest and how exactly should your body be positioned?" The answer is in part 2, and it starts right now. Part 2. The 4 sleeping positions that protect your brain, your heart, and your independence after 60. Position 1. Left side sleeping with a pillow between the knees and proper neck support. It is one of the most powerful and accessible changes any senior can make tonight. Take Mr. Bernard, a 72-year-old retired electrician from Alabama. For years Bernard woke up every morning with such severe lower back pain and hip stiffness that his first hour of every day was spent simply trying to move freely. He had resigned himself to accepting it as the price of getting older. During a routine visit, I asked him one question. "When you sleep on your side, are your knees touching?" He looked at me and said, "Always, every night." That night Bernard placed a firm pillow between his knees and made one small adjustment to the height of his neck pillow. Within 10 days he called my office and said, "Doc, I woke up this morning and walked straight to the kitchen. No stopping. No holding the wall. I just walked." When you sleep on your side without knee support, your top leg falls forward, rotating your pelvis and creating sustained torsional stress on your lumbar spine all night long. The pillow between the knees keeps your hips perfectly aligned, your pelvis neutral, and eliminates that grinding rotational pressure from your lower back entirely. According to research published in the Journal of Orthopedic and Sports Physical Therapy, left side sleeping with proper knee and neck support reduces lumbar spine pressure by up to 45% compared to unsupported side sleeping, and significantly improves overnight blood pressure stability. Left side sleeping is specifically beneficial because it positions your stomach below your esophagus, using gravity to prevent acid reflux, keeps your aorta flowing in its natural direction, and reduces the pressure on your vena cava, the major vein returning blood from your lower body to your heart. It also naturally maintains an open airway, making it one of the safest positions for seniors at risk for sleep apnea and stroke. Bernard's story is not unusual. Simple alignment changes produce profound results because they are working with your body's natural design instead of against it. But if left side sleeping is difficult for you to maintain through the night, the next position was built exactly for you. Position 2, the zero gravity incline, head and knees elevated together. For seniors who cannot comfortably maintain a side sleeping position, This is what I consider one of the most therapeutic sleep positions in all of geriatric medicine. Take Mrs. Constance, a 75-year-old retired pharmacist from Virginia. Constance had lived with severe acid reflux and nighttime breathing difficulties for years, waking up multiple times each night coughing, throat burning, convinced something was seriously wrong. Her pulmonologist had tried medications. They helped a little but never fully. When I suggested elevating her upper body to 35 degrees and simultaneously raising her knees to roughly heart level, she was skeptical. "It sounds like I would be sleeping in a hospital bed," she told me with a small laugh. "Try it for 1 week," I said. Constance called me on day 4. She said, "Dr. Rose, I slept through the night. The whole night. I do not remember the last time that happened." When your upper body and knees are elevated simultaneously, your body enters what biomechanical researchers call a neutral gravitational posture, where your spine experiences minimal compressive load, and no single area bears disproportionate weight. According to a landmark study from the Sleep Research Society, this position reduces obstructive sleep apnea episodes in seniors by up to 58%, dramatically lowers nighttime acid reflux, reduces venous pooling in the legs, and measurably decreases resting heart rate and blood pressure throughout the night. You do not need an expensive adjustable bed to achieve this. A quality foam wedge pillow for your upper body and a standard pillow stack beneath your knees can produce nearly identical results. Gravity becomes your most powerful overnight medicine. Your airways stay open, your acid stays down, your heart rests easier, and your brain receives the steady uninterrupted oxygen supply it needs to protect itself through every hour of the night. But there is still another position that addresses something most seniors carry silently every day. Position 3, the open starfish back position with cervical support. There is a kind of quiet courage in lying completely open, arms gently spread, palms facing upward, chest open to the ceiling, legs relaxed, every muscle finally releasing what it carried through the day. Many seniors have never tried this position because it feels exposed, unfamiliar, too still. But for those who learn to rest in it correctly, it gives back something they had forgotten they were missing. Take Mr. Eugene, a 68-year-old retired carpenter from Oregon. Eugene came to me with chronic tension headaches that began every morning before he even got out of bed, numbness and tingling in both hands that lasted for hours after waking, and a stiffness in his shoulders so deep he could no longer raise his right arm above his head. 3 different specialists had treated the symptoms. Nobody had asked about his sleep position. Eugene slept tightly on his side with both arms folded beneath his body, compressing the brachial nerve plexus all night long. I recommended the open starfish position with a specifically contoured cervical pillow to maintain his neck's natural curve. Within 2 weeks his morning headaches had reduced by more than half. Within a month the numbness in his hands was gone entirely. He told me, "Dr. Rose, I feel like someone turned the lights back on. When the arms are free and the shoulders are not compressed beneath body weight, blood flows unobstructed to the upper spine, the neck, and the peripheral nerves of the hands." Harvard Medical School research confirms that this open back posture reduces cervical nerve impingement, decreases tension headaches, and because the chest is completely unobstructed, allows maximum respiratory expansion throughout the night, lowering blood pressure and reducing the cardiac workload that accumulates when breathing is even subtly restricted during sleep. Dr. Angela Forrest, a neurologist specializing in sleep-related nerve disorders, calls this position nature's overnight decompression for the upper body. One small caution: if you have lower back sensitivity, place a small pillow beneath your knees to maintain your lumbar curve and prevent that familiar aching that can develop with extended flat back positioning. With that simple addition, this position becomes one of the most complete and restorative options available to seniors. And now for the position that brings everything together. Position 4, the 35-degree left side recline, the ultimate senior sleep position. Imagine a position that gives you the airway protection of elevation, the cardiac benefits of left side sleeping, the spinal relief of proper alignment, and the deep restorative sleep your brain and body have been quietly desperate for. That is what geriatric sleep specialists now call the optimal senior sleep position. And it is simpler to achieve than you might imagine. Take Mrs. Viola, a 79-year-old retired librarian from Louisiana. Viola had tried every position, every pillow, every mattress. Nothing gave her lasting relief from the back pain, the nighttime breathlessness, and the morning exhaustion that had defined her sleep for nearly a decade. She came to me as a last resort, tired in a way that had become her entire identity. Together we built her position carefully. A firm wedge pillow elevating her upper body to 35 degrees. Her body turned gently to the left side. A pillow between her knees keeping her hips aligned. A contoured cervical pillow cradling her neck in its natural curve. The first night she slept 5 uninterrupted hours. The second night 6. By the end of the first week she was sleeping 7 to 8 hours straight for the first time in nearly 4 years. She came to her follow-up appointment and sat down across from me and simply said, "I forgot this was possible. I forgot what it felt like to wake up and want to be awake." According to research published in the Journal of Clinical Sleep Medicine, this combined elevated left side position reduces stroke risk-related sleep apnea events by up to 62%, decreases acid reflux episodes by 68%, improves cerebral blood flow measurably, reduces nighttime blood pressure fluctuations, and supports the lymphatic drainage process that clears neurotoxic waste from the brain during sleep, directly linked to the prevention of cognitive decline and the long-term protection of memory. Dr. James Whitfield, Director of Geriatric Sleep Medicine at a leading university hospital, describes this position as the closest thing we have to a nightly prescription for brain and heart protection in adults over 60. Sleep is not merely recovery. It is your body's most powerful act of self-preservation. And the position you sleep in is either supporting that process or silently working against it every single night. As we grow older, every hour of sleep carries more weight than it ever did before. It is not just rest. It is the time your heart repairs the stress of the day. It is the time your brain washes away the toxins that would otherwise accumulate and damage it. It is the time your spine decompresses, your joints restore themselves, and your immune system rebuilds what the world has worn down. The positions we talked about tonight are not complicated. They do not require a new bed or an expensive doctor's visit. They require one intentional decision before you close your eyes. One pillow placed with care. One gentle shift to your left side. One small elevation that lets gravity do the healing work it was always designed to do. Your body is not your enemy. It is the most faithful companion you have ever had. It has carried you through every hard morning, every long year, every joy and every grief. And tonight it is asking you for one thing. Give me the position where I can heal. Start with just one change tonight. Because somewhere between closing your eyes and opening them tomorrow morning, your body is doing something extraordinary. Let it do that work in safety. Let it do that work in alignment. Let it do that work in the position it was designed for. Because when you finally give your body the rest it has been asking for, it gives you back something no prescription can provide. Clarity, strength, and another beautiful morning where your best years are still unfolding ahead of you. Sleep well. Stay safe. And remember, the most powerful health decision you make today might just be the one you make tonight before you close your eyes. If this video helped you, please leave a comment with 1. If not, leave a 0 so Dr. Rose can keep improving for you. Do not forget to like this video, share it with every senior you love, and subscribe to Dr. Rose, so we can keep bringing you the health truths that could change and protect your life. Thank you for watching. This is Dr. Rose. And here is to waking up stronger tomorrow.